okay, this is not the way to go. And then it's not the same as a pelvic exam, because then maybe like, oh, is he giving a pelvic exam? Well, this was like the massage they were giving. But gynecological massage, that's not a medical thing. It's like not the same as a pelvic exam. So with the pelvic exam, what's happening is that we're not stimulating the external genitalia. What happens is that the OBGYN is going to palpate and feel the reproductive organs. And what you notice here is that they're pressing in the abdomen. They're also feeling the inside here, palpating the cervix and the vagina. So what they're doing is trying to feel for physical abnormalities. So what are reasons, or what are they trying to detect with the pelvic exam? So what they're trying to do is, one thing they might be checking is how the uterine wall feels. And so the uterus has many layers, and what we have here in general. So there are three main layers. There's a perimetrium. So again, that prefix peri means something surrounding. So this is a membrane, or the surrounding of the uterus itself, the outer membrane. And then we have the myometrium. So again, myo is that prefix and root word that means muscle. So whenever there's like, we may get to talk about it in the next lecture, but myometrium, this is a cause of menstrual cramps. It is muscle, so when this contracts, this causes the uterine cramps. And then what happens with the endometrium? There are sublayers of the endometrium, but again, endo is a root word that means inner. So that's the innermost lining of the uterus, and part of the endometrium sheds every time a woman starts menstruation. All right, so then what we have for the pelvic exam, so the OBGYN is going to try to feel that area and kind of palpate it to make sure, because like if with experience they kind of know, okay, this is kind of a normal texture, or if there's any pain, then they'll kind of make a note of that and try to investigate the source of that pain. If they're pressing in your abdomen, you're like, ooh, ow. But one thing they might be checking for is endometrial cancer. Hopefully not late stage or very developed, but they might be checking for cervical cancer, endometrial cancer, because in general, just like in the prostate exam, cancers and tumors tend to be a little harder than the surrounding tissue in terms of texture. So they might be checking for that. But another thing they might be checking for are things called fibroids. Now, fibroids, notice that endometrial cancer is in the endometrium, that innermost layer of the uterus. Now, with the fibroids, what we have here is that notice that they might be inside the endometrium, but notice that most of them are in a more inner layer. So uterine fibroids are also known as leiomyomas. So it sounds like, if you know your root words, you might think like oma sounds like a tumor. It's a growth, but the good thing is that, or let's rewind a bit. So leiomyomas or uterine fibroids, they typically, instead of developing in the endometrium, they tend to develop in the myometrium, so the muscular layer of the uterus. And this is what it looks like. Notice that all these uterine fibroids, they're located not at the inner surface of the uterus, the endometrium, but they're all within the muscular wall of this woman's uterus. And the thing is that uterine fibroids, it looks scary, but they're pretty common. Like, I think I've seen stats from saying that around 35 to around 70%, which seems very high. Like, a woman might have a uterine fibroid, but they're asymptomatic, or it's not really causing them problems. But sometimes it can cause bleeding or pain, and this is something like, especially if your gynecologist is doing a pelvic exam and there's pain, they might address like treatment options for these uterine fibroids. And even though this is in the uterus, the reproductive organ, it's not a typical cause of infertility. Like, sometimes it might be. I think that there was like, they directly cause maybe 1% of infertility. So again, this is not, it looks pretty scary, but it's pretty normal, unless it's causing you pain or problems. And the good thing is that even though it has that oma suffix, yeah, they look like they take up space. Yeah, so that's the other thing. They do take up space, but they're not always going to be as big as these. And a woman might have a uterine fibroid and not even realize it, because it doesn't really cause her pain or any sort of problems. So the good thing is, like, even though they're end with the oma suffix, they rarely become cancerous. So this is another thing. Like, if your gynecologist, if you're a woman, they detect more fibroids, they might make a note of that. But or if you, especially if you have pain, they definitely will. They probably will work with you on that. So again, those uterine fibroids compared to endometrial cancer that develops in the endometrium, these uterine fibroids, they typically develop in the myometrium. And the interesting thing is that why do they tend to develop? Well, one thing that two things that cause these fibroids to develop is that these fibroids, they're very sensitive to estrogens and progestogens. So what hormones always cycle with every menstrual cycle? Estrogens and progestogens. So this is another driver of why uterine fibroids, even though they look like they take up a lot of space and they could cause problems, they're pretty common in women. All right, so then another thing with the pelvic exam, what gynecologists might be looking at is pelvic inflammatory disease. So what does that look like? Well, here we have an inflamed fallopian tube, and look at this normal fallopian tube or uterine tube compared to that inflamed one. So inflammation, what's common things? Well, yeah, you definitely see the redness, the swelling, but you also get that pain as well. So if they notice that, hey, this feeling this way, this side of doing a pelvic exam, there's pain in one side, but not on the other, they might suspect that this fallopian tube or uterine tube might be inflamed. What's the common cause of pelvic inflammatory disease? Well, bacterial infections, especially sexual transmitted infections. So we have infamous in chlamydia, and in terms of where it can affect in women, it can infect the urethra, cervix, and oviducts. So these tubes as well. But here's the catch: most women are asymptomatic if they have a chlamydia infection. That means they could have this, and maybe if they don't have, they could have an inflamed fallopian tube infected with chlamydia, but not have any symptoms. So this is like, even though these are symptoms that can occur, it's not always going to occur. And this is why it's important to get checked if you're sexually active, because about 10 to 20%, not the majority, but still, I mean, that's like a 1 in 10 or 1 in 5 chance of, if you have this infection, if you're planning on having children in the future, it could cause infertility. So this is why it's important to get screened for chlamydia and use protection. So say you might suspect that, or say you're sexually active. Well, if you're here on the UH campus, University Health Services does do STI screening and checks and treatments as well. So this is where you should go if you suspect, especially if you have those symptoms of a chlamydia or gonorrhea infection or any STI, this is where you can go. Or if you're living on mainland, this doesn't apply as much, but try to see if there's any reproductive health programs up there in the mainland. And the good thing is that there's the Liahi Clinic near Diamond Head. So that also provides free STI screenings, and it's not just for women's health, men's health as well. Both of these clinics test for STIs, and again, you don't want STIs to cause further problems in your reproductive health in the future, especially if you want to have children in the future.